Joining me right now, Dr. Deepa Verma, a synergistic health practice practitioner. Synergistic health, what's that?
Well, I named it that because it's kind of, it's integrative health as opposed to just more traditional medicine. So it's integrating mind, body, spirit. So it's like the synergy of everything working together. So.
Okay, so that would be maybe why that you decided that medical marijuana is something that you might prescribe. So let's just start from the very beginning. Why are you interested in medical marijuana?
Because I think there are a lot of patients who have a lot of chronic diseases that are refractory to traditional care or therapeutic options that are put out by the FDA, and they're looking for something more to help with their chronic medical conditions or terminal diseases.
Now, is it usually pain that they use it for?
It's pain. Amendment 2 has defined a list of chronic medical conditions that would, suggest the use of medical cannabis, we say.
Okay.
There's going to be two categories I'm going to talk about, medical cannabis and low THC cannabis. So it includes things like cancer, ALS, glaucoma, PTSD, Parkinson's, Crohn's. So there's a list that's put out there, but a terminal condition as defined by Florida medical law is a condition that's caused by, it's a medical condition or surgical condition that is going to cause significant impairment in a patient's life, and that is irreversible. And despite any therapeutic options that exist, death might be likely within a year. So,
wow. So what does the cannabis do? Does it disguise the pain? Does it fool the receptors? Does it release some kind of chemical from the brain? Or is the cannabis itself the chemical that can actually, wipe away or disguise it? What is it? Does it disguise the pain or eliminates it? What does it do?
I wouldn't say disguise, I would say it actually kind of treats the pain. So when we're talking about, chronic conditions like seizures or muscle spasms or cancer, and again, it's going to fall into two different categories. It works in the brain in terms of the receptors and neurotransmitters. So there's systems called the endocannabinoids, and there are different parts, different receptors that the brain is going to be responsive to when the patient takes in the cannabis, and there's different routes of administration, obviously. In Florida, smoking is prohibited, so the other routes of delivery would be oils, gels, the vape cartridge.
Okay, so now, why do you think they eliminated smoking as one of the potentials? Because I've heard some people that are against this have basically said, well, who ever heard of smoking curing anything or helping anything?
Right, and there might be a medical reason for it. I know out in the West that's allowed, and here, we're just starting everything and people might want to be a little more cautious, but there's going to be issues with the lungs, the inhalation of particles that can cause more damage. So you're trying to help something, but then you're also causing damage. So I think that's part of the reason.
So you are now you are licensed to administer cannabis. What did you have to do to get your license?
You have to be an active physician or you have to be a physician with an active unrestricted license. You have to be a physician, which means you have to be an allopathic or osteopathic doctor, which means you have to be an MD or DO. Okay. And you have to take an 8-hour course and an exam, and you have to take that once every 2 years to have your certification remain active.
Now, is this like, I'm thinking of pharmacology in terms of how much dosage a person should have based on their weight, their characteristics, and those kind of things. Right. Does the dosage work the same for medical marijuana?
It does. It does. There's low, so let me just explain. There's going to be two categories. There's low THC cannabis and there's medical cannabis. Low THC cannabis is going to have a lower component of THC, which is a psychoactive component that's known to cause the high that we talk about. Okay. And by definition, you have to have less than 0.8% of the THC and greater than 10% of CBD, which is a cannabidiol. Again, there's going to be different parts of the cannabis plant. Sure. And low THC, it can involve the flower, the resin, the seeds. But for medical cannabis, it's going to have a higher component of the THC. So it can be any part of the plant, whether it's growing or it's not. And then you can calculate the dosages, based on that.
Now, I'm just trying to understand this. So, what is the component that brings the relief from pain? Is it the high that brings the relief, or not?
No, I mean, we don't really want the patients to achieve the high because then we worry about them smoking it for recreational use and, getting addicted to it, I guess, is some of the concern.
That's what I want to know.
So it's not the high, it's what it's doing in the brain and how it's acting to help with patients' chronic pain that they get from these terminal conditions.
Now, people that walk into your door, well, let me step back a little bit.
Sure.
You can't prescribe this today, can you?
I can.
You could.
I am currently licensed. I took
the
exam.
But it's not available yet, is it?
There are 6 authorized dispensaries in the state of Florida.
Oh, that are operating?
They are. They are Chestnut Tree Hill Farm, there's Certera Therapeutics, there's Truly, which is actually, there's one in Clearwater right by my office. There's Knox Medical Nursery, there's Modern Health Concepts.
So there's been some controversy because the way we've been reporting it as we've been getting this news from the legislature is they haven't set all the rules up yet. And those rules then have to be approved by the state health department. So, and I guess I'm wrong then, that I was under the understanding that none of this could be dispensed as of yet.
It's an ongoing process. So as of January 3rd, 2017, Amendment 2 went into effect.
Yes.
And all these dispensaries have been set up. And I know True Leaf they made their first home delivery back in July of 2015. So things are still kind of, or 2016, I'm sorry. Things are still, it's like the carpet's being rolled out.
Right.
But the dispensaries are set in place. And what we can do now, what patients can do now is they can go on the website, Office of Compassionate Use, and there's a registry. And it's going to be a physician registry, and they can find any physician in the state of Florida who is authorized to prescribe the medical cannabis or low THC cannabis. And on the same note, the physicians can go on and see what patients are registered there. So once the patient is approved, after an initial treatment plan is set up, they're going to go on a registry and they get a unique identification number.
Okay.
So an initial treatment plan must be set up. The patient has to be established with the physician for 3 months.
Okay.
They can't just walk in and into my office and say, "Hey,
Right.
Dr. Verma, I have to assess them." If I'm going to prescribe medical cannabis, it has to be deemed as a terminal condition, which I described before,
Sure.
by 2 qualified physicians. So I would be the first qualified physician, and based on their terminal condition or illness, it have to be deemed appropriate by a second physician who's board certified in that area. So if it's ALS, a neurologist. For low THC cannabis, it's a condition that would be, chronic seizures, muscle spasms, and things like that.
So again, the bottom line, I want to make sure our viewers are not confused that if
Right.
you have a terminal condition, you can get medical marijuana. You don't have to wait the 6 months to 9 months before this all gets worked out as far as what dispensaries are allowed to do, et cetera, et cetera, et cetera.
Correct. You have to just set up your, make sure you're with a physician for 3 months. I would
okay,
develop
right,
an
yeah.
initial treatment plan, and then from there on, I have to submit a quarterly treatment plan to the University of Florida College of Pharmacy, and it has to explain their symptoms, the route of administration, plan duration, all those things.
Wow.
It's very, very strict monitoring.
Yeah, it sounds like it. So if somebody wants to get a hold of you, how do they get a hold of you?
Well, you can go on my website. It's www.drdeepaverma.com or synergistic.health.com. And I'm in Clearwater,
Wow.
so.
I want to get you back in about 6 months after some of your patients have had some experience with this to try to figure out how well it's working and to see when the rest of these rules are put in place. So, Doctor, thank you so much for stopping by. I appreciate your time.
Thanks for having me. Thanks.